My name is Dr. Eckes. I'm a board certified surgeon, and I want to talk to you today about what a sleeve gastrectomy actually is. So, a sleeve gastrectomy is a surgery that we perform as weight loss surgeons to actually make patients' stomachs smaller to help them get full faster and lose a significant amount of weight. It's a very common procedure being performed. Actually, it's probably the most common weight loss procedure being performed worldwide. So, let's talk about first how these surgeries work. When you go back 30 years or so, these surgeries used to be performed with big cuts, large incisions, and people used to stay in the hospital for days. Now the way we perform these surgeries are using procedures that we call minimally invasive surgery. So what we do is we have small little holes that we make in patients. We have these instruments that help us operate called trocars, and we can perform these surgeries either robotically or laparoscopically. Not only does that have a better cosmetic result, but there's less scarring, less incisions, and less risk of complications such as infection. So, how does the surgery work? When you talk about performing a sleeve gastrectomy, this surgery fundamentally works on the stomach. And unlike bigger procedures like a gastric bypass, we don't actually touch the small intestines or large intestines. We only operate on the stomach. And we do this by making the stomach smaller. So now, what happens after surgery? We decrease the volume that's in the stomach so patients get full faster. We do this by removing about 80% of the stomach. So as a surgeon, my job is to go in safely and to separate the stomach from itself. And when we do that, we remove about 80%. So the stomach goes from about the size of a football to about the size of a banana. So a couple things happen when we take this part of the stomach out. The first thing that we find is patients get restricted when they eat food. They eat a smaller amount of food and their stomach stretches. It sends signals to their brain and they no longer are hungry like they were before. The other thing that we find is when patients eat, there's a hormone called ghrelin that decreases. It's a very important hormone that helps patients get hungry. So when you cut down this ghrelin hormone, patients say, number one, they're not hungry anymore. They don't have the same cravings for food and they don't want to eat. So now you have a patient that gets full fast and doesn't have the same cravings. So what we find is significant long-term weight loss. It's really a wonderful surgery. It's a different surgery than a gastric bypass, so couple things to know. Other good thing with the sleeve gastrectomy is you can always convert a sleeve gastrectomy to a gastric bypass if needed. Weight loss similar to a gastric bypass, maybe a few percentage points less depending on the studies that you see, but the risk is significantly less. In experienced hands, we think the risk is probably under 1 to 2% for most patients. Now there can be a slight increase for developing reflux in some patients, usually with a history of a hiatal hernia or undiagnosed reflux. By and large, I think this is one of the safest operations out there. Couple things to remember: if you're choosing a surgery like this, please make sure you do it with experienced hands, preferably at a center of excellence. Also make sure that you have a good program that has really catered to optimizing you as a patient to have the best long-term results and short-term results. Thank you for watching.